Scenes resembling war play out from Morocco to South Africa. The African continent is rushing to contain the spread of the worst pandemic in a century. Governments have enforced the harshest restrictions in living memory as the world battles the novel coronavirus.
This is a mercy mission, this is a life restoration mission, and this is a life-saving mission, and this is a life-giving mission.
Over 500,000 people across the globe have contracted COVID-19. Tens of thousands have died, and the number is rising fast. Africa lags behind the epicenters in China, Europe and the US, with positive diagnoses in the lower thousands. But that number too is climbing. In the past week, the first official cases appeared in Libya, Guinea-Bissau and Mali. Meanwhile, Nigeria, Kenya, Zimbabwe and South Africa had their first deaths. Health experts say that the world's poorest continent is especially vulnerable and that these figures likely fall far short of the reality. Authorities have taken this seriously. Streets emptied in Kigali as Rwanda became the first African country to order a nationwide lockdown. On Friday, South Africa followed suit. Police on the streets checked that residents stayed indoors. For the next 3 weeks, jogging, dog walking and the sale of alcohol are all banned. In Kenya, police fired tear gas to clear public markets. Ugandan police shot 2 men who ignored transport bans. Public places, like Egypt's Pyramids of Giza, were disinfected to reduce the risk of infection. Mali faces challenges on all fronts. It is battling to control jihadist conflict and reported its first cases of COVID-19. A nighttime curfew is now in place. But President Ibrahim Boubacar Keïta decided to press ahead with parliamentary elections, even after the main opposition leader was kidnapped. Gunmen abducted Soumaïla Cissé and shot dead his bodyguard in the centre of the country on Wednesday. As with the global economy, the virus is taking its toll on business in Africa. Flower farming is big business in Kenya, but its roses are rotting as the virus shuts down flights and demand from Europe.
It's affecting my life because I have children going to school. I myself, I need food, clothing, paying rent, and everything of the sort.
The government has announced significant tax breaks to try and ease the burden of reduced trade. On Twitter, Senegal's President Macky Sall called for the cancellation of Africa's debt. Others, like traders in Madagascar, see a business opportunity.
Before, I sold toothpaste and earned 10,000 ariary a day. Now selling masks, I go home with 30,000 ariary every night.
Meanwhile, artists are turning to the internet to reach audiences stuck indoors. In Burkina Faso, a traditional storyteller live streams his tales to maintain the practice of oral storytelling.
As there are no more spaces to tell stories, for us it is essential to be able to continue so that we don't lose touch, because as an artist I need that. I need to continue to transmit.
But the virus has affected art in other ways. Many global celebrities have succumbed to COVID-19. One of them was Cameroon's Afro-jazz veteran Manu Dibango. This legend of African music died in hospital in the Paris region at the age of 86. As lockdowns start or continue in the next few weeks, public messages to prevent infections have become a mantra, like this one from Ugandan musician turned politician Bobby Wine. Wash your hands, keep a distance from others, prevent the spread.
Bad news is that everyone is a potential victim, but the good news is that everyone is a potential solution.
Subscribe Mwananchi Digital.